Hi all, welcome to the video. Today we are discussing about the chapter Introduction to Public Health. In the previous video, we discussed about health, public health, what is the history of public health, and the changing concepts of health and concepts of causation. And in this video, we are discussing about the changing concepts in public health and the Millennium Development Goals. So let's start the session. Changing concepts in public health. In the history of public health, there are four distinct phases. They are disease control phase, health promotional phase, social engineering phase, and health for all phase. The respective years are also given here. Disease control phase from 1880 to 1920, health promotional phase from 1920 to 1960, social engineering phase from 1960 to 1980, and health for all phase from 1981 to 2000. You should correctly know the order of these phases and the years, correct years. These can be asked as MCQs in your NEET MDS exams, and so we can check the details of these phases. Disease control phase. This phase aimed at control of man's physical environment like sewage disposal, water supply, etc. And this phase was not aimed to control any specific disease. The main movement of this phase is sanitary legislation and sanitary reforms. This is the important point. Then next phase is health promotional phase. This phase was between 1920 to 1960. During this phase, it was realized that the public health had neglected the citizen as an individual. So to overcome this, one more goal was added to the public health, that is the health promotion of individual. One more goal to public health, that is health promotion to individual. So many personal health services were introduced. To promote individual health promotion, so many personal health services are emerged. Some examples are mother and child health service, then school health service, then industrial health service, then mental health and rehabilitation services. Mental health and rehabilitation services. Then the two great movements during this health promotional phase was the primary health centers and sub-centers and the community development program. The provision of primary health centers and sub-centers. Provision of basic health services through primary health centers and sub-centers. The concept of health center was given by Lord Dawson of England in 1920. Lord Dawson of England in 1920 gave the concept of health center. So introduction of primary health centers and sub-centers. Then the second movement was the community development program. This program was to promote village development through active participation of the whole community and on the initiation of the community. Community development program was aimed to promote the village development through community participation. This is the most important points in health promotional phase. Social engineering phase, 1960 to 1980. During this period, there are so many chronic diseases began to emerge. Many of the acute illness problems were solved because of the control of the physical environment, and chronic diseases began to emerge. So these chronic diseases cannot be controlled by the traditional approaches to the public health. So there was a new concept, that is risk factors. So the new concept was risk factors as determinants of disease. The disease was caused due to risk factors. The chronic diseases means what? Diseases like diabetes mellitus, cardiovascular disease, then alcoholism, etc. These are the chronic diseases. These cannot be prevented or controlled by the traditional uh, traditional public health approaches. So, and the concept of risk factors was uh, okay. Then, to solve these problems, public health moved into preventive and rehabilitative aspects of the chronic diseases and behavioral problems. During social engineering phase, almost all the acute diseases can be uh, controlled by controlling the physical environment of the man. Physical environment of man. But the chronic diseases began to emerge. Chronic diseases like diabetes mellitus, alcoholism, cardiovascular diseases, etc. Then, then the concept of risk factors came. Risk factors as determinants of disease. So the public health moved into preventive and rehabilitative aspects of the chronic diseases and behavioral problems. This is the social engineering phase. The last one is health for all phase, 1981 to 2000. During the above three phases, that is the disease control phase, health promotional phase, and social engineering phase, the 80% of the world's population was neglected. They too have an equal claim to health care, protection from killer diseases of childhood, and to primary health care for mothers and children. So against this background, the 30th World Health Assembly in May 1977, 30th World Health Assembly, 30th World Health Assembly, May 1977. They resolved main social target of governments and WHO in coming decades should be the attainment by all the citizens of the world by year 2000 of a level of health that will permit them to lead a socially and economically productive life. That is, by the year 2000, all the persons, all the persons will all the citizens of the world will get a level of health that will permit them to lead a socially and economically productive life. On 12 September 1978, the joint WHO UNICEF International Conference at Alma-Ata called for acceptance of the WHO goal of health for all by 2000. And this proclaimed primary health care as a way to achieving health for all. Primary health care as a way to achieving health for all. And in 1981, the 34th World Health Assembly World Health Assembly formulated and adopted the global strategy for health for all.
At 30th World Health Assembly held on May 1977, they proclaimed the main social target of governments and WHO should be the attainment by all the citizens of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. On 12th September 1978, the joint WHO-UNICEF International Conference at Alma-Ata, they introduced primary health care as a way to achieve health for all. And the 34th World Health Assembly 1981 adopted the strategy for health for all.
So the changing concepts in public health was disease control phase, health promotional phase, social engineering phase, and the health for all phase. Next is the Millennium Development Goals. Millennium Development Goals. In Millennium Summit in September 2000 at New York, the representatives from 189 countries. In Millennium Summit held on September 2000 at New York, representatives from 189 countries participated. They developed developed Millennium Development Goals by setting time-bound targets, and the deadline was on 2050. So 15 years gap. So they set some time-bound targets, and the time to achieve these targets was 2050. So there are 8 goals. These are known as Millennium Development Goals. The 8 goals are eradicate extreme poverty and hunger, achieve universal primary education, promote gender equality and empower women, reduce child mortality, improve maternal health, then combat HIV, AIDS, malaria and other diseases, ensure environmental sustainability, develop a global partnership for development. These are the 8 Millennium Development Goals. Try to by heart these 8 goals. Don't go into details. These are the Millennium Development Goals. These Millennium Development Goals was introduced by the Millennium Summit in September 2000 at New York by representatives from 189 countries. They set time-bound targets and the deadline was on 2050. And these were the 8 Millennium Development Goals. Next is Health for All in 21st Century. There are 4 concepts in public health. The last one was Health for All. This was during 1981 to 2000. So in May 1998, the WHO adopted a resolution in support of the new global Health for All policy. So in May 1998, WHO adopted a new policy. In this new policy, there are 10 global health targets. 10 global health targets. In these 10 global health targets, the 4 were health outcome targets. 4 were health outcome targets. 2 were targets on determinants of health. Targets on determinants of health, and 4 targets was on health policies and sustainable health systems. In May 1998, WHO adopted a new policy for Health for All policy. In this, 10 global health targets were there, and in this, 4 were health outcome targets, 2 targets on determinants of health, 4 targets on health policies and sustainable health systems. So we can look what are the 10 global health targets. First 4 are health outcomes. So health equity, childhood stunting. Don't go into details, just know these names only. Health outcomes. First 4 were health outcomes. First one, health equity, childhood stunting. Then survival, maternal mortality rates, child mortality rates, life expectancy. Reverse the global trends of 5 major pandemics. Reverse the global trends of 5 major pandemics. These 5 major pandemics were AIDS, malaria, TB, tuberculosis, then diseases related to tobacco. Diseases related to tobacco. Then the last one was violence. Violence or trauma. AIDS, malaria, tuberculosis, diseases related to tobacco, violence or trauma. These were the 5 major pandemics. To reverse the global trends of 5 major pandemics. The fourth one was eradicate and eliminate certain diseases. Eradicate and eliminate certain diseases. This outcome included in measles, then lymphatic filariasis, etc. So health outcomes. Health outcomes, health equity, childhood stunting, survival, maternal mortality rates, child mortality rate, life expectancy. By 2020, these all maternal mortality rates, child mortality rates were should be reduced, and the survival rate and the life expectancy should be increased. Then reverse the global trends of 5 major pandemics. The 5 major pandemics during that period was AIDS, malaria, tuberculosis, diseases related to tobacco, violence or trauma. Then the last one is eradicate and eliminate certain diseases like measles, lymphatic filariasis, etc. The next two are determinants of health. Improve access to water, sanitation, food and shelter. Improve access to water, sanitation, food and shelter. Then measures to promote health. Measures to promote health. The last 4 are targets on health policies and sustainable health systems. They were develop, implement and monitor national health for all policies. Develop, implement and monitor national health for all policies. Improve access to comprehensive essential health care. Improve the access to comprehensive essential health care. Then implement global and national health information and surveillance systems. Support the research for health. Support research for health. These were the 10 health targets. 10 global health targets for health for all policy. So this much is included in this video. The rest of the chapter will be discussed in the next video. The next video will be about the primary health care, Alberta Declaration, then the landmark committees in public health, then the concepts of prevention. So this video includes this much only. So hope you all enjoyed and you understood it well. So, so thank you all.